A member of the COVID-19 task force has given her assessment of how the country is handling the pandemic. While the Bahamas is doing better than many countries, she says Bahamians must continue the practices which have led to the progress that's been made to date. Here's Cleopatra Murphy.
With 42 active cases and 97 confirmed cases of COVID-19 in the Bahamas, Director of the National HIV/AIDS Infectious Diseases Program, Dr. Nakia Forbes, says the Bahamas has succeeded in flattening the curve, this despite there having been no roadmap for managing the virus.
We are seeing an impact in terms of the efforts that everybody is making. Individuals, the health sector. We are seeing a reduction in the number of cases on a day-to-day basis, and we have flattened the curve. That is a very good thing, and it is because of all of the efforts made by everyone.
While Bimini, which is currently under lockdown, has emerged as a hotspot for the virus, Grand Bahama, that had 8 confirmed cases, now has no active cases. Forbes says despite this progress, the island is not ready to be reopened.
It's too soon in my medical opinion, even though the last case there was April 30th. When we look at the details around that case, she is a case that, well, obviously had no known travel history in that our borders have been closed for a long time. So we do not know who was her contact, who actually infected her with COVID-19. So that being said, there is enough information to make us know that there should be other persons with COVID-19 that are either asymptomatic or pre-symptomatic or having very mild symptoms in Grand Bahama possibly, and so we have to use caution. It's not time for Grand Bahama to lift precautions at this time based on my medical opinion.
With the Centers for Disease Control and Prevention now highlighting that the primary mode of transmission for COVID-19 is droplets, Forbes says this does not mean people should let down their guards.
It's possible that COVID-19 can land on surfaces. And if you touch those surfaces and if you bring the virus on your hands close to your eyes, nose, or mouth, there is the possibility that you can infect yourself. That, according to the CDC, is probably not the main mechanism by which this virus can be transmitted, but we cannot dispute the fact that it is possible. And so in that regard, we would continue to recommend those public health steps. Keep your hands clean, hand washing, soap and water or sanitizer, and not to touch your face.
She also advises that residents continue to wear face masks and practice social distancing, adding that with more than 5 million cases of COVID-19 globally, people have to learn to live with the virus and make modifications to ensure safety. Cleopatra Murphy, ZNS Network News.